Welcome to Clinic Talk, where real-life questions meet real medical advice. I'm Dr. Ben, your host, and today we're talking about one of the most common complaints I hear in my office: constant tiredness and weakness. Let's step into the consultation room.
Good morning, doctor. I'm here because I just don't understand what's happening to me anymore. I feel weak all the time. Even when I sleep well, I wake up tired.
Good morning, Mrs. Williams. I'm glad you came in. Tell me a bit more. How long has this been happening?
For about 3 months now. At first, I thought it was just stress from work, but even during weekends when I rest, I still feel drained. Sometimes my legs feel heavy and climbing stairs feels like a workout.
Really, that must be frustrating. Do you also notice shortness of breath, dizziness, or headaches?
Yes, especially headaches, and sometimes I feel my heart racing, even when I'm just sitting down.
All right. Weakness can come from many things, but let's break it down simply. The first and most common cause, especially in women, is anemia. That's when your body doesn't have enough healthy red blood cells to carry oxygen. Think of red blood cells as little delivery trucks that take oxygen to your muscles and brain. If those trucks are few or running half empty, you'll feel like your energy battery is always low, no matter how much you sleep.
So, even if I eat well, I can still have anemia?
Exactly. It's not just about eating, but what you eat and how your body absorbs it. For example, if your meals lack iron, folate, or vitamin B12, your blood cells can't form properly. Or sometimes, even if you eat well, your stomach might not be absorbing nutrients due to ulcers, gastritis, or certain medications.
Wow, I didn't know that. What else could cause it?
Good question. Another possible reason is thyroid problems. Your thyroid gland controls your metabolism, like the engine speed of your body. If it's underactive, you'll feel sluggish, sleepy, and even gain weight. There's also chronic stress, dehydration, poor sleep quality, or sometimes underlying illnesses like diabetes or kidney disease. That's why it's important not to ignore fatigue that lingers. What I usually do for patients like you is run some basic tests. A complete blood count, CBC, to check for anemia, thyroid function test, fasting blood sugar, and sometimes a kidney and liver function test, just to be sure everything is fine under the hood.
Okay, that sounds like a lot, but it makes sense.
Don't worry, they're all routine blood tests, quick and painless. But beyond tests, let's talk about lifestyle, because honestly, that's where half the battle is. Tell me, how's your diet?
Not the best. I skip breakfast most days, and lunch is usually rice or noodles. Dinner, maybe bread and tea.
Doctor, smells. The classic I'm too busy menu. You're not alone. But the truth is, food is your body's fuel. If you keep giving it the same low-quality fuel, it will eventually slow down. Try this. Add leafy vegetables like spinach or ugu every day. Include beans, eggs, fish, and liver at least 3 times a week. And don't forget fruits like pawpaw, orange, or watermelon for vitamins. Also, cut down on excessive tea or coffee. They block iron absorption.
Really? I drink like 3 cups of tea every morning.
There we go. That might be part of the problem. Replace one of those cups with water or a smoothie instead. Now, let's talk about rest. How many hours of sleep do you get daily?
Maybe 5 hours, sometimes less.
That's definitely not enough. Your body recharges during deep sleep. Without it, no supplement will fix your fatigue. Aim for 7 to 8 hours of quality sleep, preferably at consistent times. Try reducing phone use 30 minutes before bed. Blue light from screens tricks your brain into thinking it's still daytime.
Exactly. Your body's begging for rest, but your phone says, one more scroll. Another important thing, don't underestimate emotional fatigue. Stress drains the body as much as physical illness. If you've been under pressure at work, dealing with loss, or even constant anxiety, your body will respond with tiredness. Try gentle exercises like walking, stretching, or even journaling. They help your body release tension and restore balance.
That's true. I've been really stressed lately.
Then your body is doing exactly what it should. It's asking you to slow down and care for yourself. So, let's recap. You'll do a few basic tests to rule out anemia, thyroid, or sugar issues. Eat more iron-rich and protein-based meals, sleep better, manage stress gently, and drink more water. If we find a specific cause, treatment will be simple and targeted. And remember, feeling weak all the time isn't normal. Listen to your body early, not when it starts shouting.
Thank you, doctor. This already makes me feel hopeful.
That's the goal, to bring back energy and understanding. Have a nice day.